Pronto.
Olá. Actually, this this seminar is going to be in English, so I will shift my brain to English as we were just chatting in Portuguese. So this is the Coffee and Science, and this is a space at the University of Oxford to talk about Brazil. So we host Brazilians at Oxford, developing research at the university, and also researchers that are in Brazil and are our collaborators who share a little bit of their findings with us here. And today I have the pleasure to have a colleague of ours, former student at Oxford, who is presenting, but I will let Darlan make the introduction. And for that, I will introduce Darlan, who is co-chairing the seminar series with me. Darlan has graduated as a pharmacist at the Federal University of Ceará in Brazil. And he has a master's in allergy and immunopathology from the University of São Paulo. And he currently is a PhD candidate in zoology here at the University of Oxford. And he applies genome sequencing to understand virus evolution and spreading of outbreaks. Well, I don't have to say much that Darlan's research is now very important, very famous on the COVID outbreak. My name is Andresa. I'm currently directing the Brazilian Studies program here at the university, and I am also a lecturer here. And Darlan, please introduce our guests.
Thank you, Andresa. And good afternoon, everyone. For us here in the UK, almost good evening. So it's my pleasure to introduce Rafa. Rafa is more than our guest today. Rafa is also our friend. We've all been working on Corona in the last this past year, right, all together in different projects. So it's really nice to be able to have Rafa today in our Coffee and Science, and to be able to share, a little bit of all this wisdom that he has in terms of human mobility and how it can affect our lives. So Rafa works as a researcher and head of the data science team at the Department of Regional, Urban, and Environmental Studies and Policies at the Institute for Applied Economic Research, Ipea, in Brazil. His research looks broadly at how urban and transport policies shape the spatial organization of cities, human mobility patterns, as well as their impact on social and health inequalities. In 2019, Rafa's work received the award for Best PhD Thesis in Transportation by the American Association of Geographers, AAG, and the Young Researcher of the Year award by the International Transport Forum. Rafa has a background in sociology and demography, and obtained his PhD in geography from the Transport Studies Unit here at the University of Oxford. So Rafa, thank you very much again for accepting our invitation, and the floor is yours.
Okay, guys, thank you very much for the kind invitation, Andresa and Darlan. When they sent me the invite to come here and talk to you guys about my research, I was very, very happy. It's very good to be back at Oxford, even if just virtually for a moment. As Darlan said, I did my PhD at Oxford and I finished it in 2018. And since then, I came back to Brazil, where I work at the Institute for Applied Economic Research in the Brazilian federal government. And since I came back to Brazil, one thing that I really wanted to do was to leverage on all the knowledge and the methods that I learned during the PhD to expand my research into Brazil. During my PhD dissertation, I looked mostly at the city of Rio de Janeiro, looking at the transport legacy of the sports mega events, the World Cup and the Olympic Games in Rio. And I really wanted to see to what extent I could expand that research that I did for Rio, but to cover a wider number of cities in Brazil as a whole. So once I came back to Brazil, I started this new project that's called the Access to Opportunities Project. This is an ongoing project that started last year, and it has a number of partners, from academic partners to non-academic partners, some mostly in Brazil, but also some abroad as well. And so in my presentation today, I'll be talking very briefly a bit about what this project entails, what is the aim of the project, what we have been doing with this, what we are delivering to the public, what impacts we are trying to achieve. And at the end, I'll also mention briefly how we can leverage on the data analysis and the data products that we are creating with the Access to Opportunities project to analyze all sorts of issues related to inequalities in access to opportunities in cities, and also access to healthcare facilities in contexts like the COVID-19 crisis that we are living nowadays. Okay, so what you can see by the name of the project that we're talking about accessibility. So accessibility is a long-term, is a concept that has been around in literature for a long time now. And accessibility literally means the ease of reaching destinations. So think about that, the fact that the urban policies that we create in our cities, where we build schools, where we build healthcare facilities, where we develop new housing neighborhoods, for example. These policies ultimately will affect how many and which schools or hospitals, for example, are accessible from a given neighborhood. So this ability, or this ease of easing destinations is a paramount issue when it comes to the shaping of cities and what we want from them to create more inclusive cities. So these urban policies, for example, they have fundamental implications for social, economic, and environmental performance of cities. And yet this issue of accessibility is very much understudied and overlooked by policy and practice in Brazil. You will realize throughout my presentation that I talk a lot about accessibility and not so much about urban mobility. So let me just clarify what is the difference between these two concepts. So mobility, as I was saying, mobility is actually, when we use the term mobility, we usually refer to daily travel behavior. So it's basically the patterns of the trips that people actually take on a day-to-day basis. Accessibility, on the other hand, as I was saying, is not about the trips that people actually take, but it's more about the potential trips that they could take, or how easily they could take trips and reach opportunities throughout space. So we are not so much interested in how many trips people take each day, how much time they spend commuting to work and so on, but we are more interested in how easily they could move around space to access job opportunities, how easily they could access urban and public services like schools and hospitals or grocery stores, for example. So to address this issue, we launched the Access to Opportunities project, and the aim of the project is to generate annual estimates of access to employment, healthcare, and education opportunities by transport mode in Brazil's largest urban areas. We are sharing, one of the core aims of the project is also to be able to share all the results and the data that we build on this project openly. So we are sharing the data results, the code of that we use to process of the data, and some interactive visualization, so people can go on the website and zoom in and check how their city performs compared to other cities and how their neighborhood performs compared to other neighborhoods and so on. And ultimately, the impact that we want to achieve with this project is to build a critical mass of researchers and data sets in Brazil that allows people to inform policy planning and evaluation based on evidence that tells you the relevant information about how the urban policies that we create, the transportation policies that we create, how these policies ultimately affect the access to opportunities in cities for different socioeconomic groups and ethnic groups as well. So this is an ongoing project. We started in 2019 running the analysis for the year 2019, but our plan is to do yearly, it's to go on yearly round. So we're going to do some estimates for every year since 2017, 18, 19, and so on, up until 2022. Maybe we can continue the project after that as well. So the scope of the project, as you can see, we are estimating access to employment opportunities, public hospitals of basic, medium, and high complexity levels, and also schools, including primary schools, high schools, and elementary schools as well. So we are calculating accessibility by walking, by cycling, and by public transport. And maybe in the near future, we might be able to calculate these estimates by cars as well. So this is depending on some partnerships that we're trying to pull off with Waze or Google and Uber as well. So this is still in negotiation. So in 2019, this was the first year of the project. That's when we launched the project, and we wanted to start a little bit small, and we estimated in the first year access to opportunities in 20 cities. So for public transport and active transportation modes, walking and cycling, we calculated for the some of the 7 largest cities in the country. We were only able to calculate this analysis for public transport for the 7 cities because these are only the few cities in Brazil that actually share their public transport data openly available. For the other cities in Brazil, we were able to calculate accessibility by walking and cycling alone. To do this, we combine all sorts of data. So we combine administrative records, household surveys, satellite imagery, and collaborative mapping. So among administrative records, we include the HISE dataset, which is a national register with all the firms in Brazil. The National Register of Healthcare Facilities by SUS, and the school census by the Ministry of Education. So these 3 data sets here, they're federal administrative records, and they give us a list, like a comprehensive list of all the firms, healthcare facilities, and schools, and their address. With this information, we can geolocate where those establishments are located, so we know exactly the latitude and longitude of those facilities in all those 20 cities in Brazil. And then we need a very important piece of information, which is the GTFS dataset, which is basically the geolocated micro data of the public transport system. So this is the most detailed information you can have on public transport systems, and this is generated by local transport authorities. As I said, many transport authorities in Brazil have this data, but they don't share them openly available. And this is by far one of the most important limitations of our project today. So we combine this with household surveys, mostly the population census conducted by Ipea, and also satellite imagery that give us the information about the elevation or the topography of cities, because the topography of cities, as you can imagine, is very important for cyclists and pedestrians to decide which route they take when they go from A to B, for example. We combine this with data from collaborative mapping of OpenStreetMaps, which give us all the streets, the street networks of cities. And then here's where the magic comes. So to calculate this accessibility, the first thing that we need to do is to estimate the travel times. So basically, we divide cities in this hexagon grids of about 350 meters. This is a very high spatial resolution. In each hexagonal grid cell that you can see, depending on the city, you would have maybe 5 or 4 urban blocks within that cell. And basically what we need to do now is to calculate if you lived in that specific hexagon cell and you wanted to travel to the hexagon cell next to you or the other one, how much time would it take you to go from point A to point B? If you did this walking or cycling or taking public transport. So it's basically very similar when you go on Google Maps and you say from Google, you tell Google Maps you want to go from, let's say, your home and you want to visit your partner, or you want to go to your job, for example. In Google Maps, will tell you, well, you just go out of your building, you walk along the street, wait for 5 minutes, and then you take bus number 35. Bus number 35 will take 20 minutes. Will drop you at this bus station, and then you can walk along the way to your destination, and so on. So it is a very sophisticated way to calculate the door-to-door travel time from every block in the city to every other block in the city. So we calculate these huge travel time matrices from every point to every other point. And this is something we could do theoretically, we could do on Google Maps, but it would take a really long time and really a lot of resources, because we're dealing with 20 cities, and we're dealing with travel time estimates during peak time and during off-peak time, and this involves more than 1.6 billion queries of origin and destination. So we have to do all this computation within our computational servers, only using open source software. And as I said, all the methods and the computational code is openly available. Okay, this is just the computational sign behind it. But then you have the travel time matrix, so you know how much time it takes you to go from point A to point B. You know where people are distributed across space. You know how jobs and schools and hospitals are distributed across space. And now with this information, we can combine all of this to calculate accessibility. And there are hundreds of accessibility metrics. You can measure accessibility using dozens and dozens of different indicators. For this specific project, we are only calculating 2 indicators that are very simple and yet very easy to communicate with policymakers for now. So the first one is what we call the time to closest opportunity. And the second one is what we call the cumulative opportunity metric. And this will become clear right now what I mean by these indicators. So just for the sake of illustration, this is the city of Rio de Janeiro. And the map you see on top shows you the time it would take a person to go from her building block to the closest healthcare facility of medium complexity. And the map on the bottom shows you the times it would take that person to go to the closest high complexity healthcare facility. So the hexagon cells that you see colored in yellow are places from which people would take less than 5 minutes to arrive at a hospital. Green areas are places from where people would take something between 10 and 20 minutes. And dark blue areas are places where people would take more than 30 minutes to arrive at a hospital using public transportation. So 2 things come out very clearly of this analysis. And the first one is, obviously, we have a much higher number of medium complexity healthcare facilities in the city. So the services is much better widespread in the city, have a much better capillarity of the service, and people can more easily reach them. The second result, I think it's very interesting, and I think it's fascinating. Every time I deliver this presentation to policymakers, mayors, or people who work in health and transportation in local governments, they look at this map, and you can see that dark areas are what we call opportunity deserts. So those are the areas which a much more chronic lack of access to healthcare facilities. And this is a kind of very interesting and compelling way to show information and tell you if you're going to plan where to build new hospitals or to reorganize your public transport system to increase people's access to those healthcare services, those black spots or those dark spots are probably the most immediate things you should be thinking about. The second indicator that we calculate is what we call the cumulative opportunity metric. So this is the city of São Paulo. And on the left-hand side, I will draw your attention to the map on the left. This map is showing the proportion of all the jobs in the city that you could reach under 60 minutes by taking public transport. So mind you that we are not talking so much about where the jobs are distributed. We are talking about how the distribution of the transportation network and the connectivity of the transportation network increases people's access to job opportunities, even though they might live far away from the city center. So again, really dark areas are places where people have access to fewer jobs. This really bright yellow part of the map shows you where people could reach close to 60 or over 60% of all the jobs in the city in just 1 hour by public transport. If you know São Paulo very well, you can immediately see that the map is indicating where the high capacity transportation corridors are located in the city. So you can see the distribution here of the bus corridors, the BRT corridors, subway, and train lines as well. And I always like to draw your attention to this bright spot on the extreme east side of São Paulo. So São Paulo is very, very known to have a relatively poor and economically deprived area in the east side, the Zona Leste. And even in the east zone of São Paulo, where you have very few job opportunities, you have this solitary bright spot of a high access to opportunities here. This is a subway station. So even though people in this region of the east zone of São Paulo might live very far from the city center, if the person can very quickly reach that subway station, make a transport connection, that person can have close to 50, could potentially access 50% of all the jobs in the city just by taking public transport and walking. I think this map speaks a lot about the importance of how public transport networks, they increase access to opportunities precisely for the population in the peripheries in marginalized areas of our major cities. So one of the key ingredients that I like to discuss every time we talk about this project is not so much about these maps and how you can see the spatial inequalities, but it's also about the socioeconomic and racial inequalities in access to opportunities. So this is a very key topic that we want to address in this project, and I'll show you just one quick example of how we can measure access inequalities and access opportunities with this data. So in the map I just showed you, we were looking at how many jobs a person could reach by taking public transport within 1 hour. Now imagine a different indicator. Imagine how many jobs a person could reach just by walking within 30 minutes. So this indicator tells you very much about where the location of this person lives, and how the location of this person's household is privileged in the sense of being in having proximity to amenities and job opportunities in the city. So what we do now is that we calculate the number of jobs a wealthy person could reach within 30 minutes of walking. And we calculate the average number of jobs that the poorest population in the city could reach within 30 minutes of walking. We divide one value by the other, and then what we get is what we call the Palmer ratio. So this tells you the fact that the city of São Paulo, the Palmer ratio equals to 9.5. In practical terms, it means that the richest population in São Paulo can reach 9.5 more jobs than the poorest population in São Paulo. Obviously, São Paulo is the most extreme case, is the largest and also most unequal city in the sample that we have in this project. But even the city of Maceió at the bottom of the chart, which is the least unequal city in our sample, even in Maceió, the richest population can still reach almost twice as many jobs as the poorest population. So this is just a very quick sample of what we can do with this data analysis. We have all the possible combinations of and analyzing access by walking, by cycling, by public transport, by 3 types of schools, 3 types of healthcare facilities, and by jobs, by income, and by race categories as well. So you can have all sorts of flavors and different combinations of the analysis you want to take for all of those 20 cities. It wouldn't be possible for us to cover all the possible analysis that we would like to in the project. So I will just very briefly mention one quick analysis that we did with this with the results of the project that I think are very timely to the moment we are living with the health crisis of the COVID-19. So early in April this year, we started a collaboration with the Federal University of Minas Gerais and University of São Paulo, with USP, involving some health economists and people in our team. And we're trying to understand how can we use all this massive amount of data that we are building with the Access to Opportunities project, and how can we use this data to help inform local city authorities to deal and cope with the COVID-19 crisis. So we try to address two big questions, let's say, in this report that we published early this year. The first one is that we were trying to understand how many poor and vulnerable population live far from a public healthcare facility. Looking either at healthcare facilities that are very simple healthcare facilities with low complexity, but could at least do a triage of patients who would be maybe suspected cases of infection. And on a more severe case, how far do vulnerable populations live from healthcare facilities that would be able to hospitalize patients with severe respiratory conditions in the case of the COVID-19 crisis. So this map, again, is showing the city of Rio de Janeiro in Brazil. And the map on top is really is basically indicating the colored areas you see is basically indicating all of the urban blocks or the city blocks in the city where you have people above 50 years old of low income who live further than 30 minutes walking to the closest basic healthcare facility, like Posto de Saúde, for example. So we mapped that in the city of Rio, approximately 52,000 low-income and people above 50 years old who are the group of risk for COVID-19, they live far than 30 minutes from a public hospital. In the second analysis, we calculated how many of those low-income, above 50 years old people live further than 5 kilometers from a hospital that could provide hospitalization with ICU beds and ventilators. And we found that 50% of this population, approximately 384,000 people, live far from a hospital that could provide hospitalization service for severe cases. You might think that 5 kilometers is not such a big distance, or 30 minutes walking is not such a big distance. But have in mind that patients who are suspected of having COVID-19, or patients who are infected and have already severe conditions, respiratory conditions, they cannot walk very far. During the COVID-19 crisis, public transport services were very much collapsed, and in most of the capitals in Brazil, public transportation services went down up to 60 to 70% in some cities. So the provision of service is very, very much compromised. And these people are very much dependent on the public health service and on public transportation services. So they are very much isolated, so to speak, of these healthcare facilities. And again, what we wanted to show with this map is presented to healthcare authorities and transportation authorities and say, look, if you want to build makeshift hospitals or send your healthcare community agents to talk to your communities and try to help them have better access to healthcare facilities, these neighborhoods that you see painted on this map are the first to go places you should think about. So we did this analysis for all the 20 cities in the country. And we send the results and the reports and all the data to they are all publicly available. We also send it to some healthcare authorities as well in local governments. And as I said, this is all just a very quick general flavor of what we can do with this project. In 2019, we published the first report of the study where we detail all the methods that we use in the analysis, how we process the data, why we process the data the way we did. If you go on the website of our project, you will be able to see the interactive map of all the results. You can download all the data sets that we produced for all these 20 cities, and you can check our scripts, the coding analysis that we used. So in case some of you might be interested, the website of our project is written on the top of the screen, you can see. And I think I'll just close with the next steps of the project. So we are now trying to do, we're trying to look into the past and do the same analysis for the years 2017 and 2018. We are trying to expand the number of accessibility metrics that we use in the project. We are possibly expanding the opportunity types that we include in the project. For example, looking at access to libraries, green areas and parks, or bank agencies, for example. We can think about all sorts of different activities if the data is available. We are trying to include access by car as well. So we're still building on a potential collaboration with Waze and Uber, but this is going to take some time to discuss with them. And yeah, and that's it. That's the idea. I just let me see. So this is the website of the project. So you can check it in English or in Portuguese if you want. And if you go on the Explore tab, you can, again, choose English or Portuguese. You select a city. I'll just show very quickly, for example, the city of Fortaleza. So very quickly, you see in the city of Fortaleza, the proportion of jobs in the city that could be reached by public transport within 30 minutes of public transport, or within, let's say, 60 minutes of public transport, or let's say walking or cycling and so on, right? Instead of looking at number of jobs, you could see, for example, primary schools or high schools, or let's say hospitals of high complexity and so on. And obviously you can zoom in, you can check the block where you live. So for example, in this specific hexagon cell, there are approximately 1,600 people living in this block, and they could reach, by public transport within 60 minutes, they could reach approximately 68% of all the healthcare facilities of high complexity in the city. Yeah, so this is the idea. I just wanted to give you a general sense of how things are working. We are very much excited to share the project and see people's reaction, suggestions, and questions. And especially if other people would like to collaborate with the project, and like the data set that we produce are all publicly available. So you can go here online, download the data, the dictionary of the data, and so on. And the publications as well. So here where you have all the publications I mentioned before, and the other ones that are coming in the next few months. And that's it I had to present today. I'm very happy to take any questions you might have.
Thank you so much, Rafa. This was excellent. Excellent presentation, very nice findings. And Alan, do you mind if I start with a couple of questions? Your mic's is mute.
Yes, not at all. Yeah. Thank you, Rafa. This was really, really, really interesting.
Very interesting. I also like the dog very much. That's
me too.
Quick
Oh, the dog, you can see it.
Briefly, we could see it, trying to say hi to everyone.
Yeah.
Rafa, I have a couple of questions. So when you mentioned that you look at the topography of the city, which obviously impact mobility, so talking about 15 minutes of walk in a planned environment is absolutely different than in a hilly town. And so I wonder if we also talk about difference in pavements, such as driving or walking mud or dust roads versus asphalt or cobblestones, which also impact on time to reach destinations. So that would be my first question. The second question is regarding gentrification. So we know that, for example, schools increase housing prices. So sometimes you equip certain areas with some services that are missing, such as you bring a hospital to the area, or you build some schools and then it further increase, or you bring more public transport, or you lay down asphalt on the neighborhood and it increases housing prices. and then some of that population will sell their house and they will move further out. So when you are advising on policy making for where is the best place to put some of these services, how do you maybe collaborate further to then observe what happens after some accessibilities are created and some other equipments are installed, that it really serves that population rather than create what we see in many Brazilian towns, which basically, I think the name is gentrification. Even though gentrification usually talks about some enforced removal, but it is kind of organic shift of population that end up moving further out when their house sell their houses and so on. So how do you prevent that?
Okay, so the two questions are great, and actually your first question is a question I've never heard before, and I can see where it comes from. Like
from my ethnography.
Yeah, you've been working a lot with ethnography in cities with historic heritage sites, and these cities have cobblestones, and like the pavement is very different in different parts of cities, and it's actually a very relevant question. And the unfortunate answer I can give to you is that the transportation modelings that are developed nowadays and the ones that we are using, which are around the cutting edge of the methods that we have available, they do not take into account the quality of the pavement, which is unfortunate. I think this is something that could be possibly overcome over the next few years. So, I mean, we do have information on the quality of the pavement for some places with OpenStreetMaps. The thing is that, as far as I know, the algorithms that we use for the transportation routing, they do not create, they do not affect your travel time if you're walking on cobblestones or just regular pavement, for example, which is unfortunate because we know that it has a big impact on people's mobility capacity, especially if you're, let's say, a family with children and like carrying kids, or if you're an elderly person with mobility conditions and so on.
Or mud as well, like if you, like the bus can go up, so it doesn't have grip.
Exactly. Yeah. So it doesn't. Yeah. So nowadays we do not account for how the different types of pavement affect pedestrians' accessibility, which is a shame. And I think that it also speaks a lot to the challenges of getting a more fine-grained analysis about the human scale, the factors that affect human mobility at the human scale. So the other question that you have is, it's one of the most important and relevant questions. And I think it talks a lot about the time scale that we should use to plan our cities, but also to evaluate the impact of the policies that we build. So what you're saying is, it is very possible and likely, we have seen this in different cities, that you build a hospital or a healthcare facility in some neighborhood, and it will benefit immediately the people who live there, but maybe in 5 years, 10 years time, or in a longer time period, those people will be pushed out by rent prices, for example. And ultimately your hospital will start benefiting people from upper income classes, let's say. I think it tells us about two things. One is, what is the correct or appropriate time scale we should use to evaluate the impact of a policy? Because if you evaluate the impact of that hospital and how that hospital increased people's access to healthcare services, for example, if you did that evaluation 2 years after your implementation, then you would have a very successful policy, let's say. If you did the same evaluation 10, 20 years later, the result would be very different. Which one should we consider? Like, what is the appropriate timescale to evaluate? And I think there is no simple answer to this. The only thing that comes to my mind, it goes back to the other side of your question, is that even though there is a possibility, a real possibility that this healthcare facility that you build might create a gentrification process and push poor people away, I don't think that this should be a reason good enough for us to not build that hospital. We shouldn't stop building hospitals in poor areas because there is the expectation that the poor people will be pushed away in the future. it means that we should build the hospital, and when those poor people are pushed away, we build other hospitals further away, and so on and so forth. So I think, yeah, so I think
controlling policies also on, sorry, with internet so hard to interrupt, and I shouldn't interrupt anyway, so my apologies. I was just thinking about some controlling policies, such as I don't know, like cap on housing price or rental price, so people are not pushed out, or yeah, something around that. But I really liked what you said about policy timing. Also evaluate like long-term benefits, especially like on school, like school buildings tends to push price up quite a bit. I'm not sure about hospital, but also like these questions, whether it does push, which it's not very clear for me. I know that some, for example, asphalt is massively dragging price up. As soon as you have like a neighborhood that is on mud and dust, it lay down asphalt, then increase transportation, you will probably lower traveling time, you diminish traveling time, but you increase house price, like from day to night. But yeah, like as I say, it's not a reason not to put asphalt, but then to see how do you evaluate that policy, and maybe how you cap some price so that you don't push people further out. But yeah, on to you. I think is a beautiful research and with some challenge, and the policy time I think is fascinating.
Alpha, I have also a couple of questions, but we also have a couple of questions from our audience. I'll start with one of mine. So I was thinking here that can we, so I think I would assume that accessibility would be correlated to also other indicators, such as, socioeconomic status or sanitation of a place, and obviously other indicators from a specific region of a city. Would we be able to calculate how much the impact would be of accessibility in terms of, let's say, mortality of other health outcomes?
Okay, so this is the leap that we are trying to take with this project now. So the core question that I've always cut across the project is about distributive justice and equity, and think about how accessibility is unevenly distributed in space by income groups and by racial groups, and how new urban and transportation policies can help tackle those inequalities and reduce those inequality gaps, right? This is like the core topic of my research career, but I think it so far we have always been looking at descriptive analysis, and at the most we've been doing some evaluations of the impact of transportation policy. So for example, in the case of Rio, we analyze how the transport legacy of those mega events, how those legacies impacted the inequalities in access to jobs, schools, and hospitals. Who benefits and who loses from those investments? The question that you bring is the next step that we want to take with the project. It's not so much about how accessibility is unevenly distributed in cities, but how the accessibility level that a person has to schools, for example, affects the likelihood of that the children will drop out from school. Or if you're taking your kids to vaccination, for example, or you're getting out of unemployment and finding a job once you have an economic crisis. So this is the challenge that we want to take from now, and this is a really big challenge because it involves a lot of quasi-experimental research and design to identify causal links between accessibility levels and social, economic, and health outcomes. We are still like engatinhando, how do you say this? We are still like in the baby steps. We're still if like the transportation literature worldwide is people in transportation geography and transport studies, we do have very much focus. We have lots of sophisticated transportation models, but we have overlooked for a long time the causal links of how those transportation conditions affect your real life outcomes. This is something economists have been doing for quite a long time, people in public health as well, and now we're trying to make the link and connect with this type of research question.
Yeah. Also, one other thing. I was thinking here that like we're measuring accessibility as the time to reach a place, right? How long it takes to reach a place. But another layer of that is how difficult it will be, right? Because a 30-minute journey, considering that you have to take maybe 2 buses, is different than, you know, a 30-minute journey in which you can take the underground. So are there like scores or other forms of like different calculations or models that actually also account for that? So the, you know, the type of transportation that the person would be taking and other sorts of complications that could come, because let's say from bringing it to COVID, right, to our reality, I was talking about mortality, but even before mortality. So if someone, you know, is within a 30-minute journey from the hospital where they're going to be tested, but they maybe have to take 2 buses, or they live in a poor area and, you know, it's dangerous to get a bus there, they might not be as prone to take the test. And this means that they might be transmitting the disease for longer because they are actually not sure whether they're infected or not. And obviously this has an impact on the size of the epidemics in a certain region. So can we account for these factors, or is this, you know, still too advanced for us to do?
So yeah, so some of these factors are already accounted, some of them are not, and some of them we are trying to. So I have a research collaboration with colleagues in Sweden where we interviewed over 1,000 people above 70 years old, and we interviewed them about what challenges they have to riding a bicycle or taking public transport and so on. So we use the outputs of the interviews in the survey to calibrate and accommodate the transportation modeling that we do. So it doesn't really matter if your transportation model tells you that you can in 20 minutes by bike reach a hospital if the person doesn't have a bike at home. Exactly. Or if the person is afraid of falling and breaking her leg, for example. So we're trying to do this in this project in Sweden. In Brazil, we are also trying to develop a new method to incorporate the transportation cost, the monetary cost of the public transport. So looking at the fees that you have to pay, and if you combine, for example, the bus and the subway, you have to pay an additional price, and how this additional monetary costs affect your accessibility as well. Ultimately, the accessibility that we measure is not exclusively based on the travel time, because the travel, I'm showing you travel times, but actually the algorithms behind it, they calculate what we call a generalized cost. So for example, if you have to take 2 buses, for every change of vehicles that you have to take, it increments your travel time in a few minutes. So it ultimately is kind of captured in your analysis as well. What we do not capture, I think this is very important it's very important to talk, it's very nice to talk about the good things about the project, but it's very important to think about the caveats of what we don't cover with this. If the person doesn't feel safe in the public transport, if there are issues with sexual harassment, especially for women, or parents with children, usually women take much more disproportionately take the burden of household chores as well. These things put really important challenges for people to be able to use public transport, to move across cities, and to access opportunities. This subjective aspect of fear, security, and being, and even like physical challenges with walking with the trolley car and so on. These are challenges that we cannot, as yet, incorporate in the project, but we are very happy to see, for example, ethnographers, anthropologists using the data that we have to criticize the data and use the data to inform their ethnography and bring up the stories that women and other minority groups will be able to share with us.
Okay, I could go on and on forever. Like I already have more questions, but maybe we get some of the
audience
from the audience, and then if there is time, I come back.
Okay. So Vanessa Galeano, she says, "Hi, Rafael. Amazing research. Thanks for sharing. Why using hexagonal grid? Can you imagine a city with homogeneous distribution of accessibility? How would it be?"
Okay, well, the first question is a very technical one. So in the report that we published, we include some academic references to justify our choice of using hexagonal grids. I won't take too long on this, but it basically has to do with spatial ecology aspects of how data is distributed and how you calculate distances in space and how you identify neighborhoods of different polygons. It's more about the spatial econometrics of the models than the personal choice, really. We could have used like regular grid cells like a raster file or census tracts and so on. The second question was if I can imagine a plain, absolutely even city with homogeneous distribution of accessibility. We can simulate, like computationally speaking, we can do some data analysis and simulate this as playing games. Sometimes it's very good to have a look at the data results and see how they behave. But speaking honestly, there is no possibility that we will ever find any city in any place on Earth where you will have an homogeneous distribution of people, opportunities, jobs. This is just because by the very nature of how humans behave, how human societies are organized, and how you have economics of scale and organization in cities. This has been like this throughout history, throughout ages, in every place on Earth, and I doubt we would ever find a place like that.
And the second question is from Beatriz Aguirre, and she says, "Hi, Rafael. I was wondering if you have correlated the areas with more access to opportunities with its socioeconomic indicators. More access to opportunities coincide with better off areas."
Yes, absolutely. So this is one of the key questions that we addressed in the project. And I think there are two very important results. The first one is that, as you can imagine, it's very kind of expected. Higher income areas, white populations tend to have much higher access to jobs, schools, and hospitals than low-income people and Black and Pardo neighborhoods. This is systematic for pretty much every type of opportunities, for every type of public transport, or for every type of transport mode, for all of the 20 cities we have in our sample. However, the second result I think is very interesting, and the fact that when we look at the inequalities in access to jobs compared to inequality in access to schools and hospitals, for example, inequalities in access to jobs is much higher than inequalities in access to schools and hospitals. And the reason for this is that for a very long time now, our local health authorities and education authorities, they have already incorporated, even if just implicitly, they have already incorporated some notion of accessibility in their planning. So when new schools and new healthcare facilities are planned to be built, local authorities already take that spatial distribution of services into account, and they try to build those services a little bit more spread throughout the city. And this helps a lot in terms of reducing inequalities in access to opportunities.
Thank you. So I think these were the two questions we had from the audience. Andresa, do you want to ask more questions?
Yes. Okay, so times of the day, days of the week, those vary, and perhaps you can calculate it, right? Like, for example, demand for school transportation drops during weekends, but then the offer of transportation might also drop. And this affects very much access to leisure, for example, like when you make transportation so people can go to work, but then they cannot access leisure facilities because some public transport lines drop during the evening time and during the weekend, and then people are precluded from leisure access. So whether you calculate that kind of accessibility, and well, I'll talk all the questions I have because I may not have the chance to talk again. Another one is weather. floodings and extreme dry weather, like heavy rain, and sometimes it also changes transportation time. And in some cities, this is so predictable and so often that maybe you can model. I'm not sure. Finally, and I promise this is the last one, we are looking at accessibility on, and I wrote one of your definitions, like the ease of reaching destinations, but then sometimes the person already decided to leave the house. I wonder, like, if this study, which is fascinating, has also informed, like, or complemented others, such as on health facilities, coronavirus, for example. We have seen, not exactly in Brazil, but in some other place, people don't go to the hospital because they're afraid of deportation or something like that. So expanding this concept of accessibility to, or I don't know how this has been visited cross-disciplinary research to also include the what comes before the decision to actually leave the house.
Okay, I'll start with your last question because I think it's one of the most relevant. And I've never had that question before, so that's very good. Thank you. So that question is very important because what we are showing here is an effort to do the transportation side of the equation. So we're only looking at the spatial and temporal connectivity / proximity between people and opportunities. It doesn't matter. You might live 5 minutes from a healthcare facility. If you can only schedule a meeting with your doctor in 5 months, doesn't matter that you live close to the hospital. It doesn't matter that you live right next to the university. If you had a poor education when you were young, you will not be able to get into the university anyway. So we are contributing with a very, I would like to say, a very sophisticated model to analyze the spatial and temporal transportation proximity and accessibility to these opportunities. But it takes a massive amount of interdisciplinary effort to gather with other researchers in other fields and reflect about how these other non-transport related barriers can hinder people's access to those services. I know, for example, in São Paulo, there is a colleague of ours, Thiago, who did his PhD at the University of Leeds. He did a terrific job looking at accessibility to health in the city of São Paulo. And he saw that for a lot of the people who he interviewed with focus groups and interviews in general, they said that, yeah, like public transport and proximity are a barrier to get into the hospital. But having a time to get an appointment with a doctor is one of the most important barriers. Going to the doctor and the doctor having the medicine that you need is also another barrier. So there are many other things to consider there. The other question you asked about the time of the day and weekends. So we are not looking at weekends and we're not looking at leisure activities, but our analysis, we try to take into account the the time variation of how services are provided throughout the day. So we calculate accessibility by public transport during the peak time and during off-peak time. Because we know that a lot of people, especially for having access to healthcare services or sometimes schools and other activities, they might need to take public transport off-peak. And that's very important because we know that in this moment of the day, the service level is much lower with lower frequency values and so on. The other question that you had was about the floodings. So we try to get accessibility estimates that would represent the day-to-day level of service of the city. So we do not take into account, for example, congestion levels that occur because of a car crash that happened, or maybe a traffic light that stopped working, or maybe you have a flooding on that day or that weekend. So we do not take those things into account because we try to focus only on the day-to-day workings of cities. But it would be possible, like answering your question, it would be possible to use the data that we have on top of other data and do some additional transportation modeling to see how those special events, let's say floodings, for example, how they disrupt the transportation network and how this will be even more recurrent and common with with climate change, and how we can try to build more resilient transportation networks in the future.
Well, Rafa, this was incredible presentation. I'm sorry for the many questions I had because it was so interesting and so relevant. And I think Darlan's internet might have crashed. I can't see him in the studio. It's a bit unstable today, actually. I have heard this from different people. So yeah, so thank you very much. I guess we there he is. Your mic is mute.
Sorry, I think it was the internet connection.
You can blame Jerome about this.
Yeah.
But so Darlan, we were just closing. So if you want to say your
no, I would just like to say, thank you very much, Rafa. It was really extremely interesting. Like lots of questions, lots of things to discuss about this, and the intersection of this and the spread of disease and genomic data, and lots of questions. But I also would like to point out that I found it amazing how much of data availability you've been working on. Like making sure that people have access to the data, but also to your methods, to scripts, to everything. This is really amazing. This is how good science should be done. So also thank you very much for that. And I think that's it. This was a great coffee and science. I mean, it usually is great anyways. But yeah, so thank you very much for accepting our invitation. And yeah, hope to see you soon again.
Well, thank you guys again. It was really a pleasure to deliver the presentation, address all your questions and comments. Thank you for the invitation, and thank you for all my team who is like collaborating with me on the project. This is a massive project. I couldn't be doing this by myself, so I thank them a lot. This is really a team effort.
Okay. Bye, guys. Have a good week.
Bye guys.